The US and South Korea confirmed their first coronavirus patients on the same day. So how did South Korea contain its outbreak while cases of new infections in the US have soared? And what can people in the United States learn from South Koreans? We explore how South Korea's huge test, trace, and treat program and a little help from K-pop megastars BTS meant the country flattened the curve of coronavirus in a way that few others have. South Korea saw its first case of coronavirus on January 20th. A 35-year-old Chinese woman flew in from Wuhan, China. She was isolated upon entry into Seoul. But in late February, cases of the infection ballooned from fewer than 50 to over 5,000. This happened in the space of 14 days. There were 909 new cases of the novel coronavirus on a single day during the peak. South Korea had the highest number of cases of COVID-19 in Asia outside of China. The outbreak was traced back to a single patient, patient 31. She had traveled to crowded spots, including the secretive church in the southeastern city of Daegu. The church cluster was at the epicenter of South Korea's outbreak by March 18. The impact was far-reaching.
일단 대부분 사람들이 좀 외출을 많이 안 하고 있기는 하고요. 저도 지금 한 3일 정도 계속 집에 있었고 마트에 뭐 사러 나갈 때 정도만 이제 마스크를 끼고 가고 있는데
After a brief delay, South Korea got to work in containing the outbreak in a way that almost no other country has. Remember, the US and South Korea detected their first cases of COVID-19 on the same day. On March 27, South Korea reported under 140 COVID-19 deaths. The US reported over 1,600. How did things turn out so differently in the two countries?
A difficult issue for the United States is the lack of centralized messaging from the government to the general public.
Centralized communication in the Asian democracy was keeping the public well informed. It came in the form of emergency cell alerts and 2 detailed daily briefings with health officials.
We're not seeing any sort of panic buying because everybody understands that personal hygiene is their responsibility, and the ease of communication as well as transparency between the government policies and the public's attitude towards following best practices has really led to reducing the number of cases in South Korea.
5 weeks after the first American was tested for coronavirus in the US, President Trump said this.
The risk to the American people remains very low.
He continued to downplay the escalating national crisis. There was a disconnect between what Trump and health officials were saying about the virus, even as the US had the most COVID-19 cases in the world by the end of March. South Korea took everything seriously much earlier on. The country had learned hard lessons from the trauma of its MERS outbreak in 2015.
메르스 때는 사실 사람들이 안 돌아다니고 그러진 않았는데 이번에는 거리에 사람이 너무 없으니까.
And then there are the containment plans for the two countries. South Korea has a rigorous triple T system of trace, test, and treat. Let's break it down.
The first idea about tracing has to do with using the latest technology to trace the moving routes of confirmed patients.
Authorities tracked routes taken by confirmed COVID-19 patients through a variety of means. They included satellite technology, cell phone records, and credit card histories. This means the government could trace and quarantine anyone who'd had contact with an infected person. There are even GPS apps mapping out where patients of COVID-19 have been so users can avoid those places. More on the pitfalls of that later. Such tracing helped effective mass testing, with South Korea testing 20,000 people per day. From drive-through tests to phone booth-style testing in hospitals. It means these Korean call center employees can easily get tested through a mobile unit outside their office. They work in a building where there have been confirmed cases of the coronavirus. Tests take 10 minutes. Results are given over the phone 5 hours later. Nearly 100 labs were available to perform tests nationwide as of March. Oh, and testing is free and paid for by the government. You see, South Koreans have access to, you guessed it, universal healthcare. In the US, some form of insurance is required to get access to healthcare. Adding on to that problem was a lack of test kits in the US. The CDC didn't make enough test kits available or accessible. People were only able to get tested when they had severe symptoms. And the pledge to get 1.5 million people tested in a week never came through. The US did finally catch up with South Korea with over 300,000 tests completed by the end of March. But with 6 times the population and with fewer accessible tests that came out much later, the US was still way behind. Even in treatment, the two countries had 2 very different outcomes.
South Korean government invested very heavily into lab technologies and specialized treatment centers. So at this point, all confirmed patients are isolated.
By late March, over 4,100 people in South Korea had recovered from the disease. And around the same time, South Korea's COVID-19 cases were at their lowest point since the outbreak. Over in the US, hospitals became overwhelmed. New York was on a steeper infection trajectory than Wuhan in China. The city had a few thousand ventilators. It needed tens of thousands more. Rigorous prevention systems in South Korea included social distancing, school shutdowns, organized mask distribution, and screening passengers leaving the country. They also included daily disinfection of public areas like the metro or this popular market. Even BTS did their part, canceling concerts and sending encouraging messages to fans and medical staff.
힘내라! 대한민국! 대한민국! 화이팅!
That kind of collective approach and culture in South Korea was very important in curbing the crisis at an early stage.
Such preventative intervention meant South Korea was able to get away with not being in a lockdown. Of course, not everything implemented in South Korea would have potentially worked in the US. The sort of surveillance required for this level of tracing can be viewed as intrusive and as a threat to civil liberties.
I could only imagine that the public response in the United States or Canada would be very negative towards such measures. And I don't think, frankly, it would work in the North American context. But in the South Korean case, the public collectively recognized the value added in sharing such information for the greater good.
It's also worth mentioning that South Korea isn't the only place where COVID-19 seems to have been contained. There was even stronger early success in tackling coronavirus in Singapore. Even though things are rapidly changing, they didn't let it get away from them from the start.
On a grander scheme of things, there's still a lot more to go, but the efficiency and the availability as well as access to testing centers is really what sets the Korean case apart from what's happening in the United States.